So it would be very unusual, not as far as I know, but we would know that anybody who's sexually active could contract HPV. So if people were sexually active under the age of 14, then they could contract HPV. We have got cases where people have got cervical cancer under the age of 30, and in other countries you would have screening programs that started earlier. So what we would want to say about that is, if you do experience any vaginal bleeding that's abnormal, that you would need to see your healthcare professional. And also, if you go into a clinic and you see a doctor and you ask to have a cervical smear, then of course they will perform a cervical smear. But just the general recommendation for the background population of non-symptomatic people is to get screening from the age of 30 onwards. Sure, so if you've just got HPV with no cervical changes or with very mild cervical changes, what we would usually do is just watch and wait, because your immune system is still likely to clear it, okay? So we would say the most important thing that you can do if you've got HPV is to reattend your follow-up appointments. Don't assume that your body's going to clear it on its own. Make sure you attend that follow-up appointment, so follow your healthcare professional's advice. Now, if it's progressed, so it's no longer mild changes on the cervix, but it's more moderate or severe changes on the cervix, then we want to do a bigger treatment. So what we're likely to do there is we would likely to want to remove those cells. Now that can be done with two different ways. So we can use cryotherapy, which is where we freeze away the cells that look damaged on the cervix that are growing abnormally, or we can use a loop excision, which is where we use a hot loop and it just removes the cells on the cervix. And they're both the things that we would do if you had the precancerous cervical changes. Now, if that had progressed to cancer, we would need bigger treatment. So that could be with a combination of different things, but things like radiotherapy or chemotherapy or a hysterectomy, and also removal of those cells it could be. So depending on the severity of what we found. So we would not want to be treating women when they were pregnant. So if they were diagnosed just with HPV and mild changes in pregnancy, again, we would wait. When you're pregnant, your immune system's slightly lowered anyway, and we would expect those changes to revert to normal post-pregnancy. But we'd always, my big stress is that everybody should always return for their follow-up appointment. So what we don't want is people thinking, oh, it's just HPV, it's going to go away on its own. It could very well go away on its own, but we need you to get that test or go back to your doctor to have a check. So HPV will be passed around, basically. So it should be passed around. So just like cervical cancer, when I mentioned penile cancer and throat cancer. So if you're having sexual intercourse with your partner, it will be passed to and from. Now, the difficulty is that we don't know who's got it, who's clearing it, and who's not clearing it. And we don't test men for it. In some countries, we are now vaccinating boys against HPV and men against HPV as well. So in the UK or in Australia, but primary vaccination should just be for the girls at the moment, and then we will move on to vaccinating the boys here in time. So the best thing you can do to stop passing it between you and your partner is to use condoms when you're having sex. As I mentioned, that won't completely get rid of the risk, but it will lower the risk. The other thing to consider is just if you're a smoker, that you should quit smoking, because what happens when you smoke, it lowers your immune system. We think that makes it harder for your immune system to clear the virus. The other things is just boosting your immune system. So eating healthily, keeping your weight in a good BMI, so a good body mass index, making sure that you are exercising regularly, and all these things boost your own immune system. But the most important thing to remember as well is that this isn't your fault. Everybody comes into contact with this virus. Over 80% of people come into contact with this virus. So it's really important that we all remember that any one of us could have it. I could have it, you could have it, and it's not anything, it's nobody's fault, and you've not done anything wrong. We're protecting ourselves. So by getting that vaccination, or by your daughter getting that vaccination, you are going to remove the chances of her likely getting cervical cancer. Now, as I mentioned before, it doesn't completely remove the risk. So if you've had the vaccine, you still need to get your cervical screening, but it protects you against approximately 70% of cervical cancers. So you're lowering your chances by such a huge amount by getting it. So I think rather than thinking about what we could be doing for other people, it's really important to think about how we protect ourselves, our daughters, our sisters. Because as I said at the beginning, cervical cancer is by far the biggest, the most common group that we're thinking about here, rather than penile cancer, anal cancer, or throat cancer, which can also affect the men. Getting the vaccine, number 1. Number 2, using condoms. Number 3, not smoking. Number 4, keeping fit and healthy. But those are the vaccine's going to be your best at preventing that. But generally, if we're having sex without condoms, we are likely to come into contact with HPV. The problem we have is we need to educate people about what this vaccine does. So this vaccine is not going to cause harm. This vaccine's a protective function. So we know, if you look at what's happened in lots of other countries, we are now seeing the rates of cervical cancer are completely reducing. So we've got very good safety data for a long period of time. For 20 years, this has been used in Australia, and we've got such good safety data. But I think it's all about making sure that we open the conversations with the patient. So every patient that I see in clinic, I ask, when was their last cervical smear test? When did they last have their pap smear? And then if they haven't had one in the last 3 years, I make sure that we get one done then. Now, it's about healthcare providers who are going to keep the screening going. So we need to be reminding people and speaking about it, being open, having interviews like this so that people can watch and can learn about HPV and what HPV causes and how we can prevent it from causing the cervical cancer. I think so. So as I mentioned earlier, Australia is likely to eradicate by 2030. That's what their plan is. And that's through a combination of things. So that's via a very good uptake of the HPV vaccine. Secondly, a very good screening program. And thirdly, treatment that's very good, and it's early treatment of early precancerous cells. So before they've progressed to the cervical cancer stage. And with those 3, that combination of things, we can very likely eradicate cervical cancer. Now, the good things for the future are, you mentioned about previously about whether we could just test for HPV. Well, that's being used in different regions now. And that could mean that you can just do a self-swab. So you don't need to come and have somebody put a speculum in and look at your cervix. So it removes a lot of the fear associated with that. So you would just have a swab. You go to the bathroom, you do a swab around your vagina, that swab's sent off. And if you've got a high-risk HPV, you need to come and have the smear test. But if you don't have high-risk HPV, then you don't even need to come into the clinic.